Welcome to week 4 of healthcare delivery systems. Today we're still talking about regulating healthcare, and we're going to be continuing on with HIPAA and the Affordable Care Act. So this week really is going to spend a little bit more time on HIPAA, but it's a 2-part PowerPoint for this week, so we'll do this part and then part 2. As always, be sure to review the PowerPoints on your own and read the transcripts with it for more information. Those transcripts are the equivalent of your textbook and an ancillary textbook to your big one. These are the objectives for this unit as listed in your course guide. And we're going to talk about HIPAA, or the Health Insurance Portability and Accountability Act. The purpose of this act, when it was initiated, was to improve the portability of health insurance. At the time it was enacted, if you had a health plan and you left that health plan, or let's say if you left a place of employment, you couldn't take that health insurance with you. So your new employer, for example, might limit your coverage if you had a condition they didn't want to cover. Under HIPAA, they can't do that anymore. If you would lose your health insurance, it improves access to group health plans. It protected from discrimination based on your health status. The other thing it does was combat fraud, abuse, and waste in healthcare, promoted the use of health savings accounts, which are becoming more common, improved your access to long-term care, and simplified the administration of medical administration. But the big thing about HIPAA was their privacy and security rules. So the privacy requirements were what health information must be protected. What you've learned in your other class now is health information is confidential. And as HIM professionals, we live by that. But until HIPAA, there was very little legislation that said what you had to do to ensure privacy. The second part of HIPAA is security requirements, and that goes into how do you protect that information. Both the web links in here have a summary of the privacy requirements and the security requirements, and I would highly recommend that you become very familiar with these because you're going to be expected to know them. So one of the first things that HIPAA said, who does this apply to? Okay. And the first thing they said, HIPAA applies to covered entities. And what a covered entity basically says, they're your healthcare providers. And a provider is quite broadly, but it can be doctors, it can be dentists, it can be an institution, it can be a clinic, it can be a hospital, it can be a nursing home. It's any person or organization that provides healthcare, bills for healthcare, or is paid for healthcare. They're considered a covered entity, and they have to follow HIPAA's rules. Here's an example, covered entities, health plans, your insurance companies, HMOs, company insurance plans, government agencies that pay for healthcare, healthcare clearinghouses, these are places that process healthcare claims, repricing companies, community health management, value-added networks. So what HIPAA applies to then is called protected health information. Okay, protected health information is called PHI, and you see that abbreviated as such everywhere. So any individually identifiable health information is protected. So if there's a piece of that information that could identify you as a person, it's protected. So that information, it's either held or transmitted by a covered entity, or it's business associates, people they contract with, that they have to maintain your privacy. PHI can be in any form or medium, so it could be electronic record, a paper record, or an oral record. Individually identifiable information means any physical or mental health condition that can identify you, any provision of health care that is provided to you, and all payment, that's all considered part of that. But if it identifies the individual and there's a reasonable basis to believe that information can be used to identify. So they've actually done studies where they've taken information and they've hidden most of it, where all you might see is a patient's age or their address. such as their town and one other piece of information, they can identify that person. So it pertains to a lot. The other part of HIPAA that had to be followed, and you will be doing this in other classes, is called the privacy rule requirements. HIPAA requires all healthcare covered entities to notify patients of their privacy rights and allows patients to see their medical records. It says you have to have privacy practices in-house at your facility, that you have to train employees on HIPAA, and you have to designate an individual to be responsible for seeing that privacy procedures are adopted and followed. And you have to keep records secure. So one of the videos that you're going to be watching this week is just a kind of a little comedy parody of the role of the HIPAA compliance officer. But if you look at that, everything in that video covers everything in these rule requirements. But they are responsible for seeing that privacy procedures are followed. The HIPAA security rule requires covered entities to use security measures to protect PHI. It doesn't tell you what kind of technology you have to use. It tells you you have to make sure that technology is secure. So they have minimum standards. Now, the one thing about the federal regs that you need to remember, if you live in a state where your state laws are more rigorous than HIPAA, then you follow the state law. So if you ever have laws that conflict, you always follow the most stringent law there is, and that way you've covered all your bases. Generally, under the HIPAA security rules, they say you have to ensure that the confidentiality, the integrity, and availability of health information is there. So in other words, you have to prevent unwanted access to that information. You have to provide its integrity. You have to ensure that that electronic record or that record hasn't been tampered with and that it is the true record. And not only do you have to protect it and make sure it's not changed, if someone wants it, you have to make sure that it's readily available in a format. You also have to anticipate threats to the security integrity of the information and protect against them. So unauthorized access, such as something that could happen in a data breach. You have to make sure you have the tools in place to prevent that. You also have to protect against unreasonably anticipated impermissible uses or disclosure of health information. And I'll get into that in just a bit. Most importantly, you have to ensure that your workforce is following the rule. HIPAA violations are pretty serious. This slide represents fines that can occur. There's 4 tiers of violations, a tier 1, 2, 3, and 4. So for example, a tier 1 is that you were unaware of the HIPAA violation, and by exercising reasonable due diligence, you would not have known HIPAA rules had been violated. Fines are $100 to $50,000 per occurrence, a maximum of $25,000 per year. That's an oops. You didn't know it happened. You had practiced some due diligence in preventing from happening, but it happened. A tier 2 is a reasonable cause that the covered entity knew about or should have known about the violation by exercising reasonable due diligence. That is if you think or should have known that this could have happened if you did this, but you didn't do it anyway, that's a tier 2 violation. If you go up to tier 4, which is a little bit harder to read, they just get worse. But a tier 3 is willful neglect, and that one. And then tier 4 is willful neglect of HIPAA, and you knew about it. One of your assignments, you're going to look at HIPAA violations and the fines that have resulted. So fines do happen. The OCR, now go back to week 1. The OCR is the Office of Civil Rights. They're the ones who do the investigations of HIPAA violations. And they concluded 2018 was an all-time record year for HIPAA enforcement. That means it was an all-time record year to fine people. So the fines that they did are in this link. It's also a part of one of your assignments, but it's a summary of all the OCR HIPAA settlements and judgments. And as you read through them, you're going to recognize some of them because it made the national news. So here's the one. October 2018, Anthem paid $16 million to the OCR and agreed to take substantial corrective action to settle potential violations of HIPAA rules after a series of cyber attacks led to the largest U.S. health data breach in history. Anthem filed a report about the breach and that the breach had gained access to their IT system, but then they found that the cyber attacks had infiltrated their system through phishing emails. And at least one employee responded to the email and opened the door to further attacks. Most of your data breaches are caused by employee error and misuse, and that's why training is so critical. This one had the PHI of an estimated 79 million people impacted in the type of breach. So you can see why the penalty is what it was. So patient safety. This is another component of that. To err is human. Medical errors happen. They say 44,000 to 98,000 people die in hospitals each year because of preventable medical mistakes. It costs hospitals big money. Individual errors are not the main problem. Most problems caused by faulty systems, wrong processes, and conditions lead to preventable errors. So, medical mistakes today affect 1 in 3 hospital patients, and they cost money. So the Joint Commission, going back to regulation, Sentinel event, which we talked about earlier, unexpected death, serious injury, patient safety advisory group. They're there. It's also a regulation to help address patient safety. And there are protocols that you can read over. Again, the AHRQ, they look also at patient safety and what you can do working for health quality. But if you look, here's just a snippet about what they do. Research findings, effective health care, staying healthy, quality and patient safety network, patient errors and patient safety. They publish a National Healthcare Quality Report. This is a snippet of one of the reports that they do. They also go into health IT, and they talk about different systems like electronic medical records, health information exchange. And now we get to the Affordable Care Act. This is also called Obamacare. It was passed in March 2010. The goal of the Affordable Care Act was to make affordable health insurance available to more people, expand Medicaid programs to cover all adults with an income below 138% of the federal poverty level, and support innovative medical care delivery methods designed to lower healthcare costs. The Affordable Care Act really wanted to assist healthcare facilities in the implementation of their electronic health records. So the guidelines are here: improve public health, improve quality, better access, healthcare workforce training, which is where this program partially came from, and increase Medicare and Medicaid payments, and an overall system change. To learn more about the ACA elements, there are 2 websites here that you can go into. They tell you in a nutshell what it is. So if you have an assignment to do on the Affordable Care Act, this is where you want to go. Titles of the Affordable Care Act, there were different titles as listed here. Usually a federal act will have different titles, and it talks about different venues and what has to be done. Here's the website for the ACA information. Excellent site that you can go. So to regulate, there's a lot to HIPAA. And when you get to legal class, there is a big unit on HIPAA, and you're going to need to know all the terms and how to apply them on a test question. And I'll warn you right now, those are hard test questions. The other thing is thorough, complete documentation that needs to be done in compliance programs. So this is our first slide for this week, and we're going to be doing part 2, so stay with me. Thanks.